most people don't want to have surgery appropriately, but if you do need surgery, the statistics with that are really quite excellent. There's usually a 99% chance you're going to do fine with surgery, but it involves a surgeon making an incision down the middle of the chest. You have tubes coming out of parts of your body you didn't know existed. You're in the hospital 5 to 7 days, and it takes a month before you can go back to work, and 3 months before you felt like you never had anything. So it's a much longer recovery. So ideally, technology is working to do non-invasive tests, procedures, rather than open heart surgery.
Right.
But if you need it, it will fix you and is effective therapy.
You keep using the term, and I want my viewer to understand it. And you talk about arteries becoming calcified. Explain what you're talking about and how does that occur? Does that happen from the food we eat or through a process of things that occur?
Well, yeah, just heard on the radio a couple of weeks ago something about calcium causing coronary artery disease, and everybody's afraid of taking anything with the word calcium in it. Can I have a glass of milk? Well, the answer is that we don't know specifically why an artery becomes calcified. But it's not related to diet. Like if I took a calcium pill for osteoporosis, you could do that. So anybody who has osteoporosis and they got all nervous because I heard on the radio that taking calcium supplements will cause heart problems, it's not a linear direct relationship with buildup of calcium in the artery. We're not sure of the mechanism of why one person would develop calcium and the next person might not. It's more genetic that the arteries are stiffening and the mineral is just depositing in the wall of the artery. It's not as elastic. The arterial wall is an elastic, somewhat elastic muscular structure, and it can move in and out. As you get older, calcium builds up and makes it rigid. Why that happens, we don't know, and we don't know how to prevent it.
I'm going to first ask you about baby aspirin. Why should one do that? And then after that, I'm going to talk to you about statins. Baby aspirin.
Well,
do you recommend people taking that?
Not everybody should take a baby aspirin, but
what's the indication?
Anybody with heart disease should be on a baby aspirin, and I say baby. The correct word is 81 milligrams. We don't like to say baby anymore. It's an 81 milligram aspirin versus 325, which was the adult dose. And all you need is one aspirin. And what the aspirin does is it's a medication that works to inhibit platelet aggregation. Platelets clump. That's the part of the blood that initiates a clot. So when you cut yourself shaving or you cut yourself with on your hand and you start bleeding, why do you stop bleeding? You stop bleeding because your blood cells don't want you to bleed out. They have inside the blood, there's elements of the blood called platelets, and they clump together to cause a plug, which then lets the blood clot, cause a fibrin mesh, and it clots off and seals it off. What aspirin does, it inhibits that platelet aggregation, that clumping. And the first mechanism of a heart attack is that when you have decreased flow through an artery, slow flow, sort of like a river that has logs in it and leaves attached to it. When you have that obstruction of flow, flow is slower and it could clot. And the first clotting mechanism is platelet aggregation. Aspirin inhibits that. So if you're taking aspirin or something stronger like Effient or Plavix, it inhibits the platelets from clotting and prevents a heart attack. Now, that sounds great. I just take an aspirin, I'm fine? No. You know, if you have a blockage in an artery and the plaque ruptures, sort of like a pimple popping, and the cholesterol material is exposed to the blood, it's an intense exposure that causes clotting to happen right away, and that's how a heart attack happens. So an aspirin may help, but that alone usually is not enough. So as a preventative measure, aspirin's a good thing to take if you have diabetes, if you have high blood pressure, if you have known coronary disease, high cholesterol, but if you're a healthy young guy like you, and you have no symptoms attributable to your heart, then aspirin itself is not something I would just say take for every person.
Now, let's move over to the statins. Okay, that's a class of drugs that my viewers should understand, which helps you to keep your cholesterol lower. We just don't want to build up cholesterol, or the bad cholesterol, I guess. So talk about that.
Statins, and there's several of them. Statins are drugs that decrease your bad cholesterol, your LDL cholesterol. There's a good cholesterol and a bad cholesterol. The bad cholesterol is the cholesterol that builds up in the arterial walls and causes blockages. And many, many studies have shown that if you decrease your LDL, your bad cholesterol, with statin medications, you will absolutely decrease the risk of heart attack, causing plaque stabilization or regression. In other words, let's say I did an angiogram and I saw you had a 50% blockage in an artery, and I put you on a statin. would that prevent that 50% blockage from getting worse? Well, the studies are suggestive that that's the case. In fact, there's a recent study that's going to be published where we looked at high-dose statins to see if we get plaque regression. And we actually went in there and measured it with an ultrasound in the arteries. And that data is not out yet, but it's suggestive that taking high-dose statins will cause plaque stabilization, prevent progression, and maybe even regression. And it will decrease mortality in patients who have heart attacks, people who are taking statins. The question with statins is, great, everybody should take a statin? No, well, if you have heart disease, you should take a statin if you have high cholesterol.
Liver?
Well, the side effects of statins are liver, but the risk is that it's small, and if you check blood tests every 3 to 6 months, if the liver enzymes go up, you stop it, you're fine. So very rarely do you get a problem with the liver with statins. The biggest problem with statins are muscle aches. People complain of muscle aches, and that is a real problem. And there are different drugs we can give in conjunction with a statin like coenzyme Q to help decrease the muscle aches, but there's a certain percentage of the population,
no matter what,
5 to 10% of the people, no matter what statin I give them, they're going to have muscle aches, and you know what? Then you got to stop it. And someone says, what do I do? Well, there are other drugs we can give that are not as effective, but at the end of the day, just like you take the clinical history from a patient, you got to listen to your patient.
Right.
If I prescribe a medication for you and you can't tolerate it, it doesn't matter how good the journal says it is, you can't take it.
Right. When you say CoQ10, coenzyme Q10,
yeah.
what kind of, what are you talking about? 200? How many milligrams?
1 to 200 milligrams a day. But again, I wouldn't prescribe that for everybody just to take it. I try to minimize how many medications I give patients. If you're having side effects from a statin, it's an effective way to treat that.
Interesting. Okay, we only got about 5 minutes left, okay? So I want to take you to a place right now to get your thoughts, because you have your finger on the pulse of what's going on. I like the way I phrase that, considering what you do. So, so right now, stents is is the great non-invasive treatment. But what do you see in the future where maybe stents today would appear, if you think about it 15 years from now, today say, my God, how ancient we were and what we did. What do you see as the future here?
Well, the most important thing you said is 15 years, because I'll be retired by then, so that's good. All right, so I won't have to move out of my house. But what the research is looking at right now is something called bioabsorbable stents, where the stent goes in and it's sort of like invisible ink. It stays scaffolding the artery for 3 to 6 months and then disappears, so you don't need to take the platelet therapy, the blood thinner, for a long period of time. So that's the next interesting thing coming out, which will be approved in the next year or two, I would suspect.
But won't you have? I mean, you won't have. You will still have the benefits of scaffolding
for the first. You only need that for the first 6 months. After that, the artery heals.
Okay.
So when you put a stent in, the importance of it is in the first 6 months. After that, the artery's healed up.
Gotcha.
And
Okay, I didn't understand that.
So bioabsorbable stents are something that's exciting, that's coming down. But the most important thing is medication, diet, exercise, risk modification. There's no magic thing. There's genetic, using genetic testing and looking to do different types of chemicals to tag cells to see who's vulnerable with the plaque. But the bottom line, at the end of the day, and especially with the way healthcare is going, it's going to be a patient's responsibility to keep themselves healthy. They're going to have to get to the gym.
That's going to be a whole nother show.
Yeah.
Hey, listen, we're out of time.
Well,
it's great.
Thank you for
Richie,
having me.
Dr. Richard Shlofmitz, you're the best.
Thank you.
You're bright, you're intelligent, you're knowledgeable, and you're charming.
Thank you.
Listen, you're going to come back again, and we'll do...
Cook away.
Cook away. That'll be great. I'm looking forward to that. Okay, I hope you enjoyed yourself. We really had a lot of fun here discussing everything with the good doctor, and we're going to get him back, and we're going to discuss more things. I think the next time you meet Dr. Shlofmitz on television, you will get a chance to see him cooking, and we're going to discuss how you could prepare foods that will be lower in cholesterol, healthier for you to eat, so that maybe you don't have to go on all of this medication. Does that make sense to you?
Absolutely.
By the way, in 30 seconds, how does wine fit in with all of this, besides it being good? But as far as health is concerned.
Well,
seconds.
in moderation, it's fine, but whether wine helps you prevent heart disease has not been proven.
Or cause it.
It doesn't cause it, but drink wine.
Drink wine, okay. I mean, someone told me that there's a possibility of it causing a clumping of the platelets.
Unlikely. I don't think wine would cause any kind of risk factors with coronary disease. What it can cause is arrhythmias, palpitations, extra heartbeats. So if you're having problems with fluttering your heart and extra heartbeats, wine could exacerbate that.
And then if you have coffee on top of it, then you're really in big trouble. Okay, well, we got to get out of here. Listen, I hope you got a lot out of it. I certainly did, and you'll catch us again another time when you'll see the good doctor cooking. Okay, so we got to go. Dr. Pass is saying, just like Dr. Richard Shlofmitz, whatever you do it with passion, or what's the use, right? Terrific. See you again next time.